Well, good morning, everyone. I may be the only one all day to be PowerPointless, but I hope I won't be pointless. It's very, very much an honor for me to join you today and to already have had such wonderful experiences from last night when a couple of us were able to gather for a dinner and to really connect both across the country in terms of different perspectives. I know that all of you are here really studying some very, very important issues, and it's a little bit of a role reversal for me because, again, former Assemblymember Mariko Yamada, I just completed a 72-month time limit in the California State Assembly representing the 4th Assembly District, which is all or parts of 6 counties in Northern California. And so the 6 counties that I had certainly had something of everything, from rural to urban to very wealthy to very poor. And just as a snapshot of, what some of us as legislators do need to address, both from a district perspective as well as a statewide perspective. I felt very privileged to be able to do this work. I am a professional social worker by background, probably have the only non-doctorate level here on this panel. But I sort of feel like I have a PhD in life and with life experience. This is my 41st year in public service. I was a family caregiver myself for 23 years and really became an advocate for aging and long-term care issues really as a result of a family experience. So for about maybe the last 16 years or so, it's really become a very, very strong policy advocacy passion of mine, and I certainly want to thank Dr. Ladson-Hinton for extending an invitation for me to join you today as we discuss this very important work. I think, too, we all recognize in this room that if we haven't been caregivers yet, we will be at some point, or if we haven't been a consumer of some of those services, we will likely be. And it's partly what we do as students of this issue today that is going to impact not only our lives, but the lives of all of those that have already been described in these 2 previous presentations. What I wanted to talk to you about is a little bit of the context in the state of California as to where aging and long-term care policy is, and then also focus a little bit upon the issue of caregiving and the diversity of issues that we need to address. In context, and those of you from outside California know that a few decades ago we were running out of electricity. Then just in the last several years we were running out of money, and now we're running out of water. But we have somehow managed to come back each time. And now I think what we need to do is try to somewhere in the midst of all of these very daunting and major shocks to California as sort of the bellwether of the nation. And I know, there are those of you from other states that, like to believe you're trendsetters, but we kind of think, what happens in San Francisco first, then somewhat extends to California, and then sometimes, the wave goes east. But we, I think, have a really urgent responsibility as home to the largest population of older and disabled adults in the nation to really stand up very loudly and proudly to say that we need to address these issues that are undeniable, they're inexorable. Last time I checked, neither Democrats nor Republicans were getting any younger. And so we need to try to find ways for solutions to be forged that bring all parties to this discussion together around the problem. And I think, after all, that's how social workers' minds work. We think, well, we have a problem here. Let's start with where the problem is and then marshal the resources, hopefully with less of a political lens than, unfortunately, I think is dominating a lot of the discourse today, if you can even call it discourse. I think sometimes people just spend a lot of time pointing fingers at one another and blaming each other. And we have got to move beyond that, and that's part of the important work that you're doing. But again, in context in California, one of the first budget votes I took was to reduce the California state budget by $60 billion. That's how bad the budget deficit was just in 2008. Subsequent votes were to reduce by $42 billion, by $26 billion, then $23 billion, then $16 billion. And so that was the context in which many of us were serving just not too many years ago. We're in slightly better shape today because thanks to the voters, we were able to establish some temporary revenue thresholds, particularly saved us in the education area, but again, has all the impacts on human services as well. But we do not have the kind of restorations guaranteed for health and human services that we do in education in this state. And the recovery, therefore, has been uneven. I think that programs that were serving older adults took particularly disproportionately difficult hits in our state. And although we've had a committee on aging and long-term care in the assembly side or the House side of our bicameral legislature, to date, this is 2015, we have never had a committee on aging in the Senate. We've had subcommittees on health address aging and long-term care issues. You know, the code sections in the law are certainly followed by different committees, Health and Human Services primarily, which also cover the licensing parts of this discussion, both for facilities as well as caregivers and workers. But we have never had a committee on aging in the California Senate, and I think that's something that needs to be done. So anyway, let me just comment a little bit on some of the work that the Committee on Aging and Long-Term Care has undertaken in the last 6 or 7 years or so. I served on that committee my entire tenure and chaired it for 5 years. We did conduct a variety of hearings on the very issues that you're grappling with on caregiving. I didn't do a PowerPoint on them. They're on the California Assembly Aging and Long-Term Care website. Certainly can provide some of this information to you after the fact. But again, in 10 minutes to try to encapsulate maybe some of the work that we've tried to do the last 6 years, the last 10 years, there's a wealth of information, I think, already at our disposal. I think what is missing is the political will to really address and confront the issues. And it's been a long time since we've had Maggie Kuhn, the Gray Panther. I like to think of myself as since I'm born in the year of the tiger, like one of your speakers coming up, as well as Governor Jerry Brown. I like to think of ourselves as maybe the titanium tigers instead of the Gray Panthers. But we've had the Claude Peppers of the world in Congress in the past. We've had a few champions of the issue on the political levels, but it's been a little bit quiet, I think, too quiet. And some of us have been nagging about the silver tsunami for a number of years, but it's already here. It's happening with 10,000 people a day turning age 65 in our country. And so for policymakers, and the work that you're doing is so critical, to be able to communicate this information to policymakers. I'm usually on the other side, listening instead of presenting. But what I would ask you to join me in is to ensuring that, although this is a very scholarly and more academic activity that you're engaging, a very important one, that we each have to find someone in a policymaking role, whether it's at the local, state, or federal levels, to really start to champion these issues and not look at it as a cost. I'm very glad, to start off with, well, these are the facts, but we should look at them as opportunities, not, to go away further depressed as older adults, I'm going to be 65 in October, and I'm hoping there's still Medicare left for me. But it's not just for me; it's for everyone that deserves these kinds of supports in older age. And so I want to just shift just a second to some of the work that our committee did just in the past year that may have additional relevance for you today. In my final year as chair of the Assembly Committee on Aging and Long-Term Care, we began to address the intersection of aging and diversity, and that's exactly what you're focusing on here. We conducted a year-long series of hearings on aging and different population cohorts. So in February, we focused on aging in African Americans. In March, it was aging as a women's issue. In April, there's no month assigned to April exactly, but we intended to do our caregiving hearing as a focus on men. We did a hearing on aging and Latino Americans. We did a similar focus on Asian Pacific Islanders. I know Donna Yee was with us for that presentation. And we also did a hearing on aging in lesbian, gay, bisexual, and transgender. So we have a wealth of information to provide to all of you, but what we need is your policy advocacy. I know I'm running out of time, but we need your policy advocacy to identify those key leaders who will champion these issues for us in the future, because we actually are almost, thematically here out of time to make sure that we enact policies that will support all of the work that you are so hard at work to do. So thank you so very much.